A clinical nurse educator, CNE, plays a pivotal role in healthcare by educating, training, and mentoring nursing staff to enhance clinical competencies and improve patient care outcomes. This role involves designing educational programs, conducting training sessions, evaluating clinical performance, and ensuring compliance with healthcare standards and protocols. Clinical nurse educators bridge the gap between theoretical knowledge and practical application, empowering nurses to deliver safe, high-quality care. Employers seek candidates who are knowledgeable, organized, and capable of communicating effectively with diverse teams. A successful CNE combines clinical expertise with teaching skills, leadership abilities, and a passion for continuous learning. This video provides common interview questions for clinical nurse educator roles, sample answers, and practical tips to help candidates showcase their expertise, educational approach, and readiness for the position. Understanding the role of a clinical nurse educator. A clinical nurse educator is responsible for developing and delivering educational programs, mentoring nursing staff, assessing clinical skills, and promoting evidence-based practice. This role also includes evaluating training effectiveness, supporting professional development, and ensuring that nurses adhere to established standards of care. CNEs collaborate with healthcare teams, management, and other educators to maintain high standards of patient care. Employers value candidates who are patient, adaptable, and skilled in both clinical practice and adult education techniques. The role requires strong communication, organizational, and leadership skills, as well as an in-depth understanding of nursing procedures, healthcare policies, and continuing education principles. Preparing for interviews involves highlighting experience in training, mentoring, curriculum development, and fostering a culture of learning and clinical excellence. Question 1. Why do you want to work as a clinical nurse educator? Here's how you can answer. I want to work as a clinical nurse educator because I am passionate about teaching and mentoring nursing staff to deliver the highest quality of patient care. I enjoy creating educational programs, supporting professional development, and helping nurses apply theoretical knowledge to real-world clinical situations. Tip: highlight your passion for nursing education, mentoring, and improving patient outcomes through staff development. Question 2. How do you assess the learning needs of nursing staff? Here's how you can answer. I assess learning needs by conducting skills assessments, reviewing performance evaluations, and observing clinical practices. I also gather feedback from staff and management to identify areas where additional training or support is required. This approach ensures that educational programs are tailored to meet specific needs effectively. Tip: emphasize assessment skills, observation, and collaboration with management to identify learning gaps. Question 3. How do you develop training programs for clinical staff? Here's how you can answer. I develop training programs by analyzing learning needs, setting clear objectives, and creating structured lesson plans. I incorporate evidence-based practices, interactive methods, and hands-on training to engage learners. Programs are evaluated for effectiveness, and adjustments are made based on feedback and outcomes. Tip: highlight curriculum development skills, use of adult learning principles, and focus on practical application. Question 4. How do you ensure staff compliance with clinical protocols? Here's how you can answer. I ensure compliance by providing clear instructions, demonstrating proper techniques, and reinforcing policies during training sessions. I also conduct regular audits, provide feedback, and offer corrective guidance when necessary. Continuous education and open communication help maintain high standards of care. Tip: emphasize teaching skills, monitoring, and consistent reinforcement of protocols. Question 5. How do you handle resistance to new training or procedures? Here's how you can answer. I handle resistance by listening to concerns, explaining the rationale behind new procedures, and demonstrating benefits for patient care and workflow efficiency. I involve staff in discussions, encourage questions, and provide ongoing support to ease transitions and foster acceptance. Tip: Highlight communication, empathy, and the ability to motivate and influence staff positively. Question 6. How do you evaluate the effectiveness of your educational programs? Here's how you can answer. I evaluate effectiveness by monitoring improvements in clinical skills, tracking performance metrics, collecting feedback from participants, and observing changes in patient care outcomes. Follow-up assessments and refresher sessions ensure that knowledge is retained and applied correctly in practice. Tip: emphasize data-driven evaluation, follow-up, and commitment to continuous improvement. Question 7. Describe your experience with mentoring new nurses. Here's how you can answer. I have mentored new nurses by providing guidance, demonstrating clinical procedures, and offering constructive feedback. I support their transition into the clinical environment, help them build confidence, and monitor their progress through regular check-ins and performance reviews. Tip: highlight mentorship skills, patience, and ability to support professional growth while maintaining quality care standards. Question 8. How do you stay updated with the latest nursing practices and healthcare guidelines? Here's how you can answer. I stay updated by attending workshops, reviewing professional journals, participating in webinars, and collaborating with other healthcare professionals. Staying informed about evidence-based practices and regulatory changes ensures that my training programs remain current and relevant. Tip: emphasize continuous learning, professional development, and commitment to evidence-based practice. Question 9. How do you integrate technology into nursing education? Here's how you can answer. I integrate technology by using online learning platforms, simulation tools, and interactive modules to enhance learning. Virtual case studies, e-learning, and video demonstrations provide staff with flexible and engaging training opportunities while reinforcing clinical skills effectively. Tip: highlight innovation, adaptability, and the ability to leverage technology to improve learning outcomes. Question 10. Why should we hire you as a clinical nurse educator? Here's how you can answer. You should hire me because I bring a combination of clinical expertise, teaching skills, and experience in staff development. I am dedicated to improving patient care through effective education, mentoring, and evidence-based practice. My ability to design impactful training programs and foster a culture of learning ensures that nursing staff remain competent, confident, and compliant with clinical standards. Tip: summarize key strengths, focusing on clinical knowledge, teaching ability, mentorship, and commitment to continuous improvement. Final thoughts. Clinical nurse educator interviews assess teaching ability, clinical knowledge, mentorship experience, and leadership skills. Candidates should prepare structured answers, provide examples of educational initiatives, and demonstrate their ability to enhance clinical performance and patient care outcomes. Employers look for professionals who can deliver engaging education, support staff development, and maintain high standards of nursing practice. By emphasizing clinical expertise, communication, curriculum development, mentorship, and continuous learning, candidates can demonstrate readiness for the clinical nurse educator role. Highlighting the ability to handle resistance, assess learning needs, and evaluate program effectiveness ensures that you are seen as a competent and reliable educator. Thorough preparation for these questions enhances both interview performance and the overall quality of nursing education within the organization.